You're watching CTOM TV. Knowledge is power.
Okay, you can go to the next slide. So these are some of the resistance mutations. These are the most common ones. And the important take-home message here is once you stop responding to EGFR inhibitors, does not mean you need to go on to chemotherapy. What it means is that you need to find out what your resistance mutation is, and then you need to target that with a drug that targets that specific mechanism. So one of the common ones is EGFR T790M. And so if you've been on gefitinib or any of the first or second generation EGFR inhibitors, now you would go on to osimertinib, and that would work very well if you have a T790M mutation. If you have something else called a HER2 alteration, where you can get mutations in your HER2 gene. HER2 is a gene that's commonly looked at. It's a receptor, so it pokes outside of the cell. And so there's a variety of drugs called monoclonal antibodies called Herceptin and pertuzumab that can target that. So there's a ton of different treatments. HER2 overexpression is a common feature of a type of breast cancer called HER2 positive breast cancer. So all of the drugs that are used in HER2 positive breast cancers can be used for HER2 alterations. Now you have to determine whether you have a mutation, and you require a drug that targets the mutations of HER2, or if you have overexpression and you require a drug such as a monoclonal antibody that targets overexpression of the HER2. There's also another gene called BRAF. Mutations are common in that. So there's BRAF inhibitors. BRAF was first found in melanomas, and a bunch of drugs were designed to target BRAF mutations in melanomas. So now they can be used in lung cancers. There's also PIK3CA mutations. These are common in estrogen-positive breast cancers. They tend to emerge later on, after about 5 or 6 years of treatment on endocrine therapies and anti-estrogen therapies in estrogen-positive breast cancers. There's a few different drugs that can target this now. One of the ones that's recently been approved and is available in Canada now is called alpelisib. And that can be used to target mutations in any cancer that has PIK3CA mutations. There's also something called MET, another gene, and it commonly gets amplified.
Thank you for watching CTOM TV. Subscribe below and stay informed.